postpartum depression's not normal. And I have some patients who have had it in the past and are trying to avoid it going in the future. And so I just want to talk about the most common, it's not the only, but the most common mechanism for postpartum depression and what's actually going on underneath it. So if you have a tendency toward depression, the first thing you have to do is you have to look at your gut. You make 90% of your serotonin in your gut. So anytime you have depression, it's a gut issue. So, and that means usually you have an imbalance or a sterile gut and a high fungal load, okay? And fungus, when you have a high load, hijacks your blood sugar system and it causes you to have low blood sugar, which makes you crave sugar, so then you eat sugar, which feeds fungus, okay? Super simple. And so when we have that sterile gut, which means not a lot of bacterial variety and a high fungal load, right, you're not gonna be able to make serotonin as much as you need to. Now, let's say you get pregnant. Right? And hopefully you've tested your progesterone and make sure it's at a nice high level. Progesterone is a regulatory hormone for your estrogen and in men testosterone. It's super important, and it's that sense of well-being hormone. So your progesterone will go up, and when you're growing a baby, you actually have 4 glands, right? 4 adrenal glands, you have 4 ovaries if it's a girl, or you have testes and ovaries. So you have this immature system coming online making some hormones. It's starting to prep. So as a mom, we get to actually hijack that system. And no mother wants to do this. No mother knows they're doing it. And we actually utilize the baby's glandular system. And then when we birth the baby, that's gone. Poof, we're in postpartum depression. Okay? So one of the best things that you can do and is safe during pregnancy is taking and using progesterone, plant-based progesterone. We use one from Quicksilver. It's the best delivery mechanism of all of them that I have found. But you really want to go through while you're pregnant and figure out what's going on with your system and heal it, because you're also giving the microbiome that you have to your baby, which means that they are then predisposed to having the same issues we have. So we have this thing where things run in families, but they're not genetic. That's microbiome, environmental habits or environmental exposures, internal habits, and toxin load. Okay, so postpartum depression is not normal. I hope this is helpful for you if you're pregnant or if you know someone who is pregnant or has a tendency with depression. We don't want that to happen because it's a very difficult hole to get out of when you're in the thick of it. But there are things that can be done to prevent it and to mitigate it, and also in general depression as well. So hope that's helpful.